Antibiotics are often considered one of the most important discoveries of modern medicine. Before their discovery, infections that we now consider minor were much more serious and often deadly. But how do they work? Bacteria are important for our survival, and in our bodies they outnumber our human cells 10 to 1. Most bacteria live in harmony with our body's cells. The helpful bacteria that inhabit our gut, or our microbiota, play a role in our immune system and how we respond to disease. They can also aid in essential human functions like digestion. There are, however, other bacteria that can enter our bodies, reproduce, and cause dangerous infections and disease. Enter antibiotics. These drugs work by interrupting the growth process or metabolism of bacteria, or by disrupting their outer layer or cell wall. When bacteria are repeatedly introduced to antibiotics, some of them reproduce with a new mutation that makes them immune. As the other bacteria are wiped out, these evolved or resistant bacteria have room to reproduce and grow. These bacteria are harder to treat and often require more expensive and longer courses of antibiotics to kill them. Bacteria that are resistant to multiple antibiotics are referred to as superbugs. In the meantime, these resistant strands can be passed to other humans or animals and spread throughout a population. Antibiotic resistance is not a new concept, but the prevalence of it is accelerating at an alarming rate due to the misuse and overuse of antibiotics. Unfortunately, investments in developing new antibiotics to combat them have dwindled over the years. So how does it spread? Antibiotics are widely used in animal agriculture practices to promote growth and prevent infections that can spread in close quarters. This practice is so common that in some countries, 80% of the medically imported antibiotics are consumed by animals. Unfortunately, bacterial resistance can spread from animals to the environment to their handlers and into our food. Humans also misuse antibiotics by using them to treat viral infections, like colds, or by stopping treatment early, which may allow for a few bacteria to linger and reproduce, requiring more antibiotics later on and increasing the chance for resistance to develop. Antibiotic resistance is considered one of the biggest challenges to global public health today, especially with the current ease of travel. Resistance does not discriminate and can affect a person regardless of their age, geography, or status. Unfortunately, those without adequate access to healthcare and appropriate next-line medications will be affected the most. So what can be done? On a personal level, it's important to use antibiotics only for bacterial infections and to finish a course exactly as prescribed from a doctor. New policies are also necessary to reduce the use of antibiotics in animal agriculture to prevent the spread of resistance from animals to humans. More investments need to be made in developing new antibiotics to treat superbugs. And better infection control is necessary in healthcare settings to prevent the spread of resistant strains among patients and providers.